Hi, I'm Lourdes Swentek. I'm trauma critical care attending at UCI. It's not going back. Oops, there we go. Okay. So for some context, as labor progresses, women undergo several manual cervical checks to monitor the progression of labor. This is the standard of care, but unfortunately it is inaccurate by as much as 50% interpersonal variability. It's also uncomfortable and it introduces an infection risk. So much so that the rate of cervical checks is limited in most guidelines due to increased risk of infection with every single check. So I'm not the first person who thought cervical checks were a bit primitive. And in fact, there have been multiple devices, but none of them have stayed. And the devices all had something in common. While they were all more accurate in being able to measure cervical dilation, they all went through the vaginal canal, which did not address the infection risk or the discomfort. So then it hit us, a little light bulb. In 75% of pregnancies in hospitals, they use an epidural for pain control. The epidural is great for reducing pain, but it has an intended side effect of not being able to feel or move below your belly button. So a urinary catheter is always needed to ensure bladder is decompressed. So our idea is a painless and sterile process for continuously monitoring cervical dilation and fetal well-being during labor using the bladder as a conduit. So we thought of a new design for a urinary catheter that includes an attached but separate chamber that allows entry of a small 7 French ultrasound catheter. The catheter, being in an enclosed chamber, would not make contact with the urine, but can image the cervix through the bladder. In several animal, cadaver, and computer models, we could clearly identify cervical dilation via the bladder. And likewise, and more importantly, Doppler ultrasound can be easily used to monitor the fetal heart rate. And interestingly, optoacoustics is becoming really big. I'm not going to go into it right now, but it is going to allow us to know more hemodynamics with the fetus. The other cool part is one of the ultrasounds that are out that are 7 French is Bluetooth enabled. So I envision a future where soon-to-be parents are watching their fetus on an iPad as it's coming down the vaginal canal. And that is all.
Oh my